Vital signs are what we use to help us determine the health status of our client. When we're talking about vital signs, we're talking about blood pressure, pulse, respirations, temperature. Now, you may see pulse ox or oxygen saturation in there as well. However, that's not one of the key four vital signs, but we do get that. It's very important to know. We have referred to pain as the fifth vital sign in the nursing community because it is something, again, that we want to check on frequently with our clients. This slide provides descriptors of each of the vital signs and what it's measuring. So you can take a minute and review those. Blood pressure measures the pressure exerted by the blood in the circulatory system. It's measured as a larger number over a smaller number. The top number is the systolic, the bottom number is a diastolic. So you'll always see the larger number on top. If you ever see a smaller number on top, that is incorrect. Systolic is measured at the maximum amount of pressure that's exerted when the heart contracts to force blood into the aorta. So when that blood is pushing. The diastolic is the amount of pressure exerted when the heart relaxes. Now, there's a couple of terms that we need to know related to cardiac output or related to the heart, and that's cardiac output is one, and this can be measured by a bunch of different monitors, but basically what it is the amount of blood pumped into the circulatory each minute. Stroke volume is another term you may hear of, and it is the amount of blood ejected by the ventricle when that heart contracts. And we're going to discuss those further when we get into med-surg and we talk about cardiac. So when you're taking a blood pressure, make sure you're using the appropriate cuff size. If you're using a size too small or a size that's too large, that's going to give you an inaccurate reading. I prefer using a manual cuff over the wrist cuffs. If you get, regardless of what blood pressure you're taking, if you're taking it on a machine and you get a number that does not sound right, does not sound in concordance to what is normal for your patient, go ahead and take a manual blood pressure. Always have that cuff available if you need it. Now, some other things that can affect our blood pressure. If our blood pressure is high, maybe they just smoked recently or had some form of nicotine. If we have a lot of sodium in our diet that we're retaining, stress can make your blood pressure go up, pain, or increased activity. Your blood pressure could go down as a result of things like dehydration. And again, we say 120/80 is what we consider normal, but there really is no normal because some people run different ways. Now, we don't want anybody really over that number too much consistently because that's a lot of pressure for them. We do have people that consistently run low. It may be 90/60 consistently, and that's normal for them. Their body has adapted to that. A couple of things that we want to look at, a couple other terms. Viscosity. We're talking about blood's viscosity. We're talking about the thickness of the blood. And we need to remember that the thicker our blood is, the higher our blood pressure is going to be. Another term is peripheral vascular resistance. Resistance is the change in blood flow. So the more difficult or the more resistance we have for that blood flow to get through the vessels, the higher the blood pressure is going to be. Another word that we have is contractility. Contractility is measured by what we call the ejection fraction, which is the percentage of blood ejected each time that ventricle contracts. We measure this in our left ventricle because the left ventricle is the ventricle that sends the blood to the rest of the body. Another term that we need to look at is preload. Preload is the amount of blood inside the ventricle before it contracts. So if we have less fluid in our body, maybe we've hemorrhaged and lost a lot of blood, our preload will be decreased. If our preload is decreased because of that, our blood pressure will be decreased. If there's a lot of blood going, say we're exercising and we've got our heart rate really just pumping and we're getting a lot of blood moving around, that can cause our blood pressure to raise. Afterload is the amount of resistance that the heart has to overcome to eject the blood. The high afterload is your cause of hypertension. So think about if you have vessels that are calcified or that you have a lot of plaque in them, your heart has to pump harder out of its left ventricle to get that blood out to where it needs to go. And so we say that's probably going to give them high blood pressure or hypertension. So when we're talking about hypertension, we're talking about the blood pressure that is above the reference range. We call hypertension the silent killer because some people have hypertension and they don't even know it until they go to the doctor. Now, the abbreviation we use, and you'll see a lot for hypertension, is HTN. H as in Harry, T as in Tom, and N as in Nancy. If we have chronic hypertension, it can cause us to have a heart attack or stroke. It's very dangerous. Your blood pressure norms are going to vary by your age range, and any activity can change your blood pressure. So if I got up from one seat and I walked up to a different room and I sat down and I took my blood pressure there, I would expect to see a change in my blood pressure. Even something as simple as losing 5 or 10 pounds can affect your blood pressure. The more weight, the higher our weight is, usually the higher our blood pressure is. Another thing that can cause some hypertension is what we call white coat syndrome. White coat syndrome is whenever you go to a physician's office or you go into the hospital and they take your blood pressure and it's elevated. We say that people just get nervous about having their blood pressure taken about having to go see the physician, and so that causes their blood pressure to raise. Now, if you have hypertension, these are some signs that you may see. You might have a headache. That's probably the number one thing that we look at. If someone gets a really bad headache, we might take their blood pressure to see if they have hypertension at that moment. They may also experience some dizziness, some blurry eyes. And ideally, we want that bottom number, the diastolic pressure, to be below 90. Anything greater than 90, we're going to consider them hypertensive. Hypotension is when our blood pressure is less than the state of reference. So as I mentioned earlier, dehydration can cause hypotension. Blood loss. People that are septic usually have hypotension. Anytime we have someone whose systolic is below 90, we know that they're not getting the blood they need to their vital organs, so we are very concerned for them. People with hypotension can get dizziness. They might have some nausea, blurred vision. Their pulse is going to increase because it's trying to get that blood out where it needs to go, and they might experience some fatigue. So some nursing interventions that we would do for hypertension, and we want them to do things first in their diet and exercise to try to modify this. So increased exercise to help get them in shape, stress reduction. We might want them to lose some weight, put them on a low sodium diet to see if that helps. We want to potentially give them some antihypertensive medications, but when we give those, we're going to start out at a low dose and we're going to build up because we don't want to bottom out their blood pressure. For hypotension, the number one thing that we need to do is increase their fluids, okay? Maybe if they're dehydrated, if they have sepsis, they need increased fluids. We can put them in a supine position. We might elevate their legs unless it is contraindicated. We might look at some of the medications that they're taking. Are they taking too high of a dose of blood pressure medicine? Talk to them about getting up slowly because of the risk of dizziness and falling when they are changing position. And we want them to make sure that they're staying hydrated. Pulse, each one of our heartbeats, lub-dub, is considered one beat of our pulse. And again, depending on your age, that may affect the pulse reference range for yourself. For an average adult, 60 to 100 beats per minute. Now, there's some other things that we've listed here that can affect your pulse. You might, if you've gotten up and you've been running around and you just sit down, you might have a higher pulse than when you wake up first thing in the morning. If you're running a fever, you might have a higher pulse. Your age sometimes can be a factor in this as well. If for some reason our patient has an irregular pulse, we want to make sure that we take that pulse for 1 whole minute so that we get an accurate reading. The apical pulse is something that we utilize as well, and it is found at the left fifth intercostal space midclavicular line. If we're listening to an apical pulse, we want to listen for 1 full minute. Now, everybody's is at the left fifth intercostal space midclavicular line, but that doesn't mean we're going to find it at the same place on every single person. So if we have someone that's overweight or has a large abdomen, say a pregnant woman, you might have to feel where their fifth intercostal space is. Or if you have someone who's extremely anorexic, we might have to feel a little bit further down for that fifth intercostal space. You will see a grade of pulses. What we want is a +2 pulse. So a 0, if you see 0, that's going to be, you can't feel the pulse at all. A +1 pulse is going to be a very weak pulse. If it's an increased, heavier pulse, it'll be +3. And if it's really bounding and strong, then it's going to be considered a +4. So as you practice, you'll get to feel the difference between these types of pulse. But what we want them to have is a +2. So if your heart rate or if your pulse is greater than 100 beats per minute, we call that tachycardia. Tachy meaning fast and cardia meaning heart, so fast heart rate. Again, this could be because I've just finished exercising. Something might have scared me. I might have some anxiety. There's some medications that will cause you to have a fast heart rate. We know that caffeine and nicotine can cause you to have a fast heart rate. Some people are going to say, well, I just have no feelings or no symptoms at all. Some people start to feel that race and they can feel that bounding in their chest. If the pulse is less than 60, again, we're using that 60 to 100 average for an adult, then we call that bradycardia. Brady meaning slow, cardia meaning heart, so slow heart rate. It can be because of a cardiac abnormality. It can be because of heart failure. They might feel dizzy. They might be short of breath, might have some chest pain because that blood is not getting back to the heart where it needs to go. You might find if you have someone, say, who is an Olympic athlete, someone who is very, very well conditioned, you might find them to have consistent bradycardia because their heart is so conditioned, their muscles are so conditioned. So someone who is an Olympic athlete, their heart might always be at 40 beats per minute, okay? And that would be normal for them. We wouldn't worry about them because they are very well conditioned. Your body temperature is measured from the balance of heat produced by the body and heat lost to the environment. So when we're talking about core temperature, when you hear someone talk about their core temperature, we're talking about the temperature deep within the tissues of the body. Now, a true fever is not considered, or a true fever is not considered a true fever until it is 100.5 or greater. Most people run an average of 98.6. Some people may run an average of 97. Usually it's a little bit less than 98.6. So they might say, well, if I have a 98.6, I'm running a temperature. No, textbook wise, a fever is not a fever until we're at 100.5, okay, or greater. Some people will say, well, my temperature is 99.0. I have a fever. No, they don't. Again, a fever is not considered a true fever until it's 105 100.5 or greater. So what you might feel is a flushed face. You might feel warm all over, your skin be warmed. When we have a fever or an increased temperature, usually we also see an increase in our heart rate and our respiratory rate. Now, a lot of times Fever is a sign of infection. We might have someone who has hyperthermia or high heat in their body because maybe they have high heat production or they're not able to leave or lose that heat from their body. My middle child, he can run around in shorts all winter long because he produces so much heat within his body that if he starts wearing a jacket, he gets too hot. You might also watch for people in the summer. We see a lot of people out in the summer that get heat stroke because they get hot, they're outside working, they get dehydrated, their body can't cool itself anymore, and then that can lead to organ shutdown, can lead to death. So if you're caring for someone with hyperthermia, the first thing we want to do is get them somewhere cooler. We can put some cold packs on their necks, axilla, under their arms, and their groin areas. We can remove loose clothing, if they have layers, remove some of those layers, and we can also give them IV fluids to combat maybe their dehydration from sweating so much. Hypothermia is just the opposite of low body temperature. Most often we'll see this with people that are having prolonged exposure to the cold temps and their body just can't produce, or their body just can't produce heat. Specifically, I'm thinking of maybe newborns. Their body is not good at producing heat like, say, a child's is. Maybe you have someone whose organs are failing. They may go cold for a little while. Early on, you'll see they'll have shivering, which is their body's attempt to try to create heat. Might have decreased motor skills, impaired peripheral perfusion. Again, this is something that can lead to the loss of consciousness all the way to death. So for treating them, we want to give them a warming mat or a warming blanket. We can warm IV fluids. Now, we would not want to use, say, an electric blanket on them because it can cause burns for them. And again, in our newborn population, they can get hypothermia very quickly. So this is why we measure very frequently the temperature of a newborn, because if we see them starting to get cold, we can put them under the radiant warmer. Newborns do not have that shivering capacity as others do. One inspiration in and one expiration out is counted as one respiration. So breathing in causes that oxygen to go into our lungs. The oxygen goes to the alveoli deep within our lungs. Gas exchange occurs. The body picks up the oxygen, exchanges it for carbon dioxide, and that is what we expel when we are expiring or doing our expiration. Our lungs expand because we feel a contraction of the diaphragm and intercostal muscles. It is not our need for oxygen that makes us breathe or gives us the desire to breathe. It is the need to rid of carbon dioxide. Normally, an adult should have 12 to 20 breaths per minute, and that's considered a normal respiratory rate. When it is within this range, we call it eupnea. EU meaning normal. Anytime you see the prefix EU, it means normal. And PNEA, pnea, meaning breathing. Tachypnea is a respiratory rate that's greater than 20 breaths per minute. Most commonly when you see tachypnea, it's somebody having maybe an asthma attack, or we see it when we exercise, right? So to treat it, we have to treat the underlying cause. Is it because they're having an asthma attack? We got to get that breathing regulated and open up those bronchioles. Is it because they're having pain? We've got to treat that pain. If it's because they've overdone it physically, we need to let them rest. Bradypnea or bradypnea, I've heard it both ways, is when we're breathing less than 12 breaths a minute. So they're not getting the oxygen that they need, and because of this, they might complain of dizziness, fatigue, weakness. They might get confused. They might lose their coordination. Again, we have to treat the cause of this slow breathing. So are they breathing because we gave them too many opioids? Well, we can give them naloxone to reverse that. Regardless of the reason, if they're able to tolerate it, we can raise the head of the bed, and that can make it a little bit easier for them to breathe because they're not fighting against gravity. Couple of terms that we have: apnea, A meaning without, apnea, without breathing. That's the absence of breathing, when they're absolutely not breathing. Dyspnea, D-Y-S, meaning difficulty. P-N-E-A, meaning breathing, so difficulty breathing. Anytime you see the prefix D-Y-S, we know it means difficulty. Some other types of respirations that you may see, we have chain stokes. They're called chain stokes, C-H-E-Y-N-E, chain stokes. This is an irregular pattern of breathing. We see this sometimes at end of life. Is going to be probably the most common place you're going to see it, where they have patterns where they're doing shallow respirations, then they go to deep respirations, and then they go back to shallow respirations, and then they have a period of apnea, and then it starts back up. They slowly start breathing again, and it gets deeper and deeper, and then it gets slower and shallower for another episode of apnea. Another type of respiration that I want to talk about right now is a Kussmaul respiration. Kussmaul is a very deep and rapid respiration. It's just kind of a like that, okay? Usually we're going to see this when they have a high acid concentration, carbon dioxide concentration in their body. Diabetic ketoacidosis, this is when you see a Kussmaul respiration. Their body is trying to blow off some of that acid. Oxygen saturation, or pulse ox, or O2 sat, this measures the hemoglobin in our blood. So through this, measuring the hemoglobin, it's able to estimate the amount of oxygen that's riding on those red blood cells. Usually we have the pulse ox, we take it on the finger. If for some reason we can't get the finger, we might use the toe, we might use the nose, we might use the earlobe, just some extremity like that. We've gotten better with our pulse oxes, but sometimes if they're wearing nail polish, we might have to remove that to get an accurate reading. If their fingers are too cold, it will not read for them. O2 sats are decreased when someone's having a problem with their lungs or cardiac output. That blood's not moving like it should. We like for their pulse ox to be between 95 to 100%. However, when we're dealing with someone with chronic lung issues, theirs may consistently run 89, 88 in those areas, okay? If they're having hypoxia, that means they're not getting enough oxygen to the tissues. That's what this pulse ox is going to tell us. Hypoxia, hype meaning low, oxia meaning oxygen, so low oxygen. So if I have someone that I'm getting a low pulse ox on, I'm going to say, can you take some deep breaths for me, and try to bring up that oxygen rate. I can also give them oxygen if they require it. I can also give them bronchodilators to open up those airways so we can get more oxygen in. Now, I will also tell you, and we'll get into this later when we talk about these types of things, but if someone has carbon monoxide poisoning, they are going to have 100% oxygen reading. Because again, remember that pulse ox is only measuring the circulating hemoglobin. And if we have carbon monoxide poisoning, we have good blood circulation, but instead of oxygen being on those red blood cell molecules, it's going to be carbon monoxide, and that's dangerous. So again, things that can cause your decrease in pulse ox. I mentioned some respiratory conditions, things like pneumonia. You might have a lower pulse ox. Pulmonary edema. Usually the first thing that we're going to see is they start to get really restless when their oxygen is low. We might see them getting restless as their body is trying to get that oxygen it needs. They might get some anxiety as well because they can't breathe. So think about that. If somebody has their hand over your mouth and nose and you're trying to breathe, you're going to do a little bit of fighting. It's just a natural instinct. You're not going to sit there and let them do that to you. So think about that, anxiety and tachycardia. Some other things that you might see is they're all of a sudden not as alert as they used to be. They don't know where they're at. They're a little confused. So those are some things that you would see with low oxygenation.